subject is something that is very, very important to all of us, important to our communities, certainly important to all of the healthcare providers in our community, our hospitals, home healthcare, nurses, everyone else. So, as you're all aware, medicine has changed. I don't know if does that fan have to be going? I don't know if you can hear me. Does it have to? If it does.
I don't think it's the fan. I think it's the air.
Oh, is it?
It's really air off.
Oh, that's very good. It's not. I just, the noise from the,
Yeah, it's from the,
I don't know. Can everybody hear me okay? I'll yell loud. I can still hear you. Well, good, good. As everyone I think is aware, Medicare came into effect in 1965. We're still operating under the Medicare system that was put in place at that time. Everyone also knows that medicine has changed a great deal since then. And the way it's practiced, there's a much more emphasis on prescription drug coverage rather than in-hospital patient care. And that is why today we've got to modernize Medicare with a prescription drug benefit for helping seniors. And we all know of folks who have to choose between paying the rent or buying foods and necessities and paying for their prescription drugs. So we have some very good news. Last Thursday night, actually early Friday morning, about 2:30 in the morning, we passed a prescription drug benefit under Medicare that will go a long ways towards helping our seniors themselves, but also go a long ways towards helping our health care providers. And this is very, very important, which we'll get into more details later. First of all, we have a message here from the President. Is very concerned, obviously, about this issue also. And you have a small, short tape here that we're going to play for you. We have to have some 8-year-olds here to be able to run all the technology. They can figure it out.
Thank you very much. I'm honored to be able to speak to you for this important meeting. I want to thank you, Congressman, not only for inviting me, but for working so hard for this district and for this country. I'm pleased to have the opportunity to report to you on an issue that is vital to the health of seniors, the health of Medicare. For too long, too many doctors and too many Medicare patients have had to fight not only illness, but also bureaucracy. I want to save and strengthen Medicare, to make it less bureaucratic and more efficient. I also want to improve and enhance Medicare to help seniors where they need help the most, paying for their prescription medications. And that is why my administration is committed not only to strengthening Medicare, but to expanding it and ensuring that it offers seniors prescription drug coverage. The fact is that health care is changing, and Medicare must change with it. When Medicare began, health care usually meant hospital care. But today, health care often means paying for expensive, yet essential, prescription drugs. And this creates challenges for many seniors. Too often, seniors are forced to choose between paying the bills or paying for medicine. This is a choice no senior should have to make. And I want to work with Congress to ensure that Medicare pays for prescription drugs. Recently, a group of House Republicans outlined 4 goals that they will pursue in passing prescription drug coverage legislation. Lowering the cost of prescription drugs now, guaranteeing all senior citizens prescription drug coverage, improving Medicare with more choices and more savings, and strengthening Medicare for this and future generations. These are common sense goals that will mean extra dollars and better care for seniors, and I support them. I look forward to working with the Congress to get a bill passed that I can sign. The longer we wait, the greater the problem will become, and we've already waited too long. The current state of Medicare's trust funds and rising health care costs mean that Medicare's promised benefits are really not secure for the baby boom generation. The program needs to be strengthened and secured. Here are the main principles for strengthening and improving Medicare. One, nobody on Medicare will see any change in Medicare benefits unless he or she wants it. There will be new Medicare choices, and all of these choices will offer prescription drugs. Medicare plans will compete based on services and premiums. Medicare will respond better to the needs of seniors, and especially the low-income seniors and seniors with high medical bills. And Medicare will be put on sound financial footing. These are principles that will strengthen one of our nation's most important sacred obligations, the health of our senior citizens. We will protect seniors now, offering exciting new life-saving services and more choices to seniors in the future, and guarantee access to prescription drug coverage. And we will do it without overtaxing our children and our grandchildren. And let me mention one other program that is vitally important to our seniors, Social Security. I want to make this clear to our seniors. You have earned your benefits, you have made your plans, and I will keep the promise of Social Security. I'm committed to modernization that will not change Social Security benefits for retirees or near retirees. No changes, no reductions, no way. We will work to save and strengthen this vital program so that it can also work for younger Americans in the changing world of the 21st century. And that's why modernization must include individually controlled, voluntary, personal retirement accounts to support the Social Security safety net. Again, thank you all for allowing me to join me. I look forward to working with Congress to improve Medicare and Social Security for this generation and for generations to come. Our seniors deserve it. Our nation demands it. And we must get it done. May God bless you all.
I think that, the President understands, like we all do, the situation today for senior citizens. And like he mentioned, that, the choice between paying your bills and buying your prescription drugs is something that should not happen. We also have to understand we've got to be responsible for the people who are paying into the system. As you all know, back when Social Security was first started, there were 42 people working for every person getting benefits. Today, there are 3 people working for benefits for Social Security and for Medicare, so we have to be responsible. Having said that, and being responsible, in our budget in the House of Representatives this past year, we passed $350 billion over the next 10 years for modernization of Medicare itself. And most of that money goes into a prescription drug benefit. Also, there's additional dollars in that to be directed at our hospitals, our doctors, our home health care folks, our physical therapists, all of the people who provide the kind of high-quality health care that we experience here in Iowa. And we've got to make sure that we address the problems for Iowa. That is why when we had the bill on the floor last Thursday night, Friday morning, all 5 Iowa representatives on a bipartisan basis voted for this legislation, because it not only gives a real prescription drug benefit immediately, but it also addresses the inequity that we have here in Iowa as far as our reimbursements. So we're very, very pleased that it passed the House. It's going to go over to the Senate. Hopefully they'll act on it soon. Some of the provisions in the bill. Number one, it's the only bill that will immediately give you relief as far as the cost of your prescription drugs. Immediately, you can have it within 2 months, about a 25 to 30% reduction in the cost of your drugs. Number two, it'll be a voluntary program. You can either stay as you are, or you would have at least 2 other choices to sign up for a Medicare prescription drug benefit. And it is under Medicare, it's not some outside program. It will be controlled through Medicare, and we want to strengthen